forget not all his benefits. 3, who forgiveth all thy iniquities, who healeth all thy diseases. Amen.
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 There, like I was saying the other day, every situation, every problem that you have, there is a solution for it in the Bible.
Amen.
Anything that you want to be done, if you look in the Bible will tell you how to be a better friend, a better wife, a better husband, a better child. Anything is in the Bible.
Amen.
And he says that he will heal our diseases.
Amen.
But in the human standpoint, there's something that we have to do.
Oh yes.
And God, the way he works, there's something that you gotta do. You gotta do your part. There's always participation.
You got to do your
You can't
part.
just sit there and say, oh, God is just going to take care of everything, and you just lay back. You gotta do something.
Amen.
If you want to be a nurse, you gotta go to school,
Amen.
acquire that knowledge, go take the state board, pass it before
So true.
they can allow you to be a nurse. Even when you are a nurse, you still have they got these learning that we have to do every before every 2 years we renew our licenses. So there are some continuing educations that we do based on the state. For Pennsylvania, RNs we need 32. So you need to do those to be able to maintain your license.
Yeah.
Not only that, you got to be certified. If you want to do blood sugar on a patient, you got to go and do that blood sugar training. To do anything there is that you have to do, you got to do training for it. So it's the same thing with God. Just because he promises us that he's going to do some things for us doesn't mean that we're not supposed to. And I try to relate the healing of our diseases to like the basic things that people do to be able to find out what diseases people have. And the most basic thing that you need to do to keep yourself safe, to keep yourself not getting diseases that will harm you in the future, the first thing that they tell you, prevention of infection, is hand washing. That's the most basic thing that you can do. And there's a right way to wash hands, and there is a wrong way to wash hands. For me, every hospital or healthcare settings, they have hand sanitizers. I'm not a big fan of hand. It's good for people to use, but I'm not a big fan of it. I like to wash my hands. Regardless of my hands being dirty, it's not dirty. You're not hearing me?
Yeah, a little bit more.
Okay. Is that better now?
Yes.
All right. You still have to wash your hands.
Yeah.
I was trying to bring the pen to show us how to do it properly, but maybe we'll do it in the next class, just as an add-on.
They're doing the sink in the bathroom. That's not.
Yeah. No, I wanted to actually bring a pen and just show us how to do
wash
it
hands.
the proper way. Because there's a proper way to wash your hands.
So true.
And if you don't know how to do it, especially during the season where this is, we call it respiratory season. Almost everybody coming in with some type of respiratory issue. Even right today, say my voice now doing what it needs to do today. So this is respiratory season, and the basic way that you can do that is protect yourself by washing your hands and washing your hands properly. Because it doesn't help you if you do it and you don't do it the right way.
Jesus.
Another thing that helps doctors to figure out what's going on with us is labs. When you go to the hospital, if you go there with a headache, oh, my chest is hurting, the first thing they'll tell you, or do CBC, BMP, troponin, especially when you say your chest is hurting. Troponin is the test that they do when somebody has a chest pain and they are suspecting a heart attack. Because troponin is a protein and it can get high when there's injury to the muscle, to the heart muscle. So they check that to see if the numbers are high and they keep going up, then that's a concern. So labs, what are labs? They provide information about different components of your blood, including blood cells, white blood cells, platelets, labs, also any type of fluid in the body. They can check it. They can check your skin. They can check your stool. So that they can know if there's any bacteria, virals, parasites, any organism that does not belong in there, so that they can find out. And once they find out, then they know it will direct the treatment for whatever problem that you're facing. Red blood cells. So the red blood cells are important because they transport oxygen. The scientific or medical name for the red blood cells is hemoglobin. So the heme in the hemoglobin is that's the globin is the protein. So on that red blood cell, a protein goes with it everywhere it goes. So when your red blood cells are low, your oxygen levels will be low because you don't have enough oxygen going along with that blood to where it needs to go. So that's why when people have low hemoglobin, regardless of what what is causing it, they will be tired because oxygen fuels the body. So if you don't have the fuel, then you're gonna be tired. That's why people are tired. Like if you never had low blood and somebody's talking about low blood, how they tired, you just maybe they'll just sleep it off. It's not something that you can sleep off because you are exhausted. It's beyond tiredness. It's beyond tiredness. You are so exhausted. You can't even to go up and down the stairs, to even lift your legs. You can't be able to do it because you don't have that oxygen that you need to do what it needs to do for you. Let me see. I will skip some of these slides. So hemoglobin, hematocrit. It's a test that they do to see the amount of red blood cells in your blood versus the fluid along with it. So the hematocrit is the plasma, is the liquid part of the blood. It's supposed to be a certain number. And then the other part is just the cells. The hemoglobin is just the cells. So once they check it, they want it to be 12 to 15 for women, which is hard for our hemoglobin to be 12. Yeah, because when you are childbearing age or the monthlies, you can't, it's hard for your blood to be up there. But if it's at least around 10, 11, then you're okay. But they don't want it to be below 6. Once it's below 6, then it means that you need some transfusion or you need either blood or iron transfusion. For men, it's 13 to 17. For the hematocrit, they want it to be greater than 40. That's where they want it to be. And for me, I've suffered from anemia for a very long time. I used to take iron shots because my hemoglobin was low. My hemoglobin one time dropped to 6. Wow. Dropped to 6.
You got transfused?
No, I didn't. They told me, I left the ED, I went home, I did my own thing. Yeah. I was eating, the spinaches, the green apples, all the other stuff that you can take for you to be able to, to bring it up. I didn't feel comfortable getting blood. Yeah, I didn't feel comfortable getting blood. I know, but you see, sometimes people can think like, sometimes people think that these things are, you are being superstitious, but whatever personality that you have, I believe that whatever body fluid you got, that personality is in that body, in that blood, in that particular thing. That's what I believe. It's not scientific or anything, but that's what I believe. Because when you see like kids who are born who don't breastfeed, kids who are born who don't breastfeed, and then kids who breastfeed, there's a difference between their behaviors. Kids who drink cow's milk all the time, they are more hyper because of the sugar content in it. Breast milk doesn't have that amount of sugar. So it affects the way that they do behave. And for, it's all right for you to have blood transfusion. I'm not saying it's wrong, but for me personally, unless there's nothing that can be done. Yes, if there's nothing that can be done, I am going to do it. Because when I found out my hemoglobin was low, I wasn't even paying attention to my iron. Not knowing my iron was in the toilet. Iron is supposed to be, I think 11, if I'm not mistaken. My iron was 4. Yes. And I was wondering, why am I so tired all the time? But I wasn't paying attention to it. I was like, oh, maybe that's just a night shift. Maybe the night shift is catching up to me. So when they found out that my iron was 4, the doctor told me, you gotta go today. They gotta give you some iron infusion. So I took the iron infusion, I think 2 rounds. It's once a week, 5 times, 8 times, and then once a week, 8 times again. So I took the iron, and then my iron came back up to where it needs to be. It's still low, but it's not that low. Because when your iron gets that low, not only are you tired, it causes brain fog. So, and then I started noticing that when I would just, let's say I would just be talking, and then I would just forget what I wanted to say.
My God.
Yes. So whenever like those little subtle changes, when you see it in your body, it's always good for you to go and find out what's wrong. Don't just leave it, oh yeah, I will sleep it off. Sometimes there are some things that you cannot sleep off. And then when your iron is that low, not only it makes you, your brain can be foggy, you can also be confused because you're not getting enough oxygen on your brain. Wherever blood goes, oxygen goes. Oxygen is needed for basic life. Yeah. So and then it affects your whole body system. If you're not getting oxygen on your brain, it will cause confusion. You're not getting oxygen in your heart, your heart will start beating fast because you're not getting enough. Your blood pressure might go up. For me, my blood pressure stays, low, but it will happen. Because when low iron can also cause palpitation, which is like the heart is just beating fast because it's working overtime. It does not have the energy that it needs to push the blood to the place it needs to go. So these things, sometimes we don't really take it to be serious, but these are all very serious things, So the platelets is the lab that they do to show you how well your blood can clot. Your blood's supposed to take a certain amount of seconds when you cut yourself for you to stop bleeding. But if you're just bleeding, they call it pro time. It means that the time is long for you to stop bleeding, so that's not good. So they check it to see what's happening, and then they can give people medication to prevent that. But then also people who got heart problems or people who just had surgery, who have higher risk of getting their blood clotted, they can give them anticoagulants to prevent the blood from clotting so fast. So there are 2 ways. Then usually they will not give it to you like you're just a normal person and nothing's wrong with your blood, no surgery, no nothing. They won't give you a anticoagulant. So people who got AFib, that's one of the main reasons they can give people anticoagulants, is when the heart is just the top part of the heart, it doesn't rest. The atrium is just beating, and the heart rate goes up into the hundreds. And if it keeps doing that, there's a possibility that when the blood hitting on the walls of your blood vessels, little clots can form, and then that's risky. So when you have a AFib, it can lead to maybe you will have a heart attack because there's a clot in your blood, or you will have a heart attack because you have a stroke because there's a clot in your head, and it all comes from your blood just being thick enough and making clots. So they can give people medication for that. And one thing is good for us to pay attention to is if you are on those medications, like people who are on Coumadin, that's one of the most common medications that they take, warfarin. They base it on the reason why you're getting it. Some people, they will tell you they want it to be 2. Some people, they will say they want it to be 3. That's the lab test, they call it INR. That's the number that the doctor suggests. So if you're on these medicines, you should know why you're taking the number 1 and what that number is, so that when you get it checked, if it's out of range, you can make suggestions, because sometimes they can forget. And if you do your labs and you haven't heard, we always assume that when you don't hear from the doctor, it means that everything is okay. That's not true. Everything is not okay.
Wow.
Because I know that when I was pregnant with Nema, I did my first set of gestational diabetes testing. I think they can do it in the 2nd trimester. Eh?
Yeah, 20 weeks.
Yeah, they can do it in the 2nd trimester. I did it, and I don't have diabetes. But for some reason, because I had gained a lot of weight, so the insulin proportion to my body wasn't correct. So the body wasn't getting rid of the sugar the way it's supposed to do it. They found out that I was insulin resistant. They never told me. And during your 2nd trimester, you don't really go to the doctor that often, like when you get in your 3rd trimester, where you go in every week. So 1 month had passed. I'm assuming that everything is okay. So I get there, and then they tell me, oh, you failed the test. I said, but I failed the test. Nobody called me to tell me that I failed the test. And I've been living with gestational diabetes for a month.
Jesus.
So that's harmful to the baby, because whatever we eat, it goes to the baby, especially sugar. Sugar can cross the barrier and get to the baby. There are some things that can cross over, but especially sugar. So the baby is going to be enlarged for no reason, because you guys didn't do your due diligence. Honestly, I kind of blamed myself too, because I was supposed to call and find out, but we always think that
They will call you.
yeah, when they don't call you, it means that everything is okay. Whenever you go to the doctor, if it's lab, let's say you went to a lab court, and they are labs, and they will tell you, say, oh, we'll call you when the results come, give them 3 days. After 3 days, there are only certain labs that when you do, it takes maybe 3+, but most of the basic lab, they can do it within that day. And if you don't hear from them, call them back and tell them what's the result of my lab.
That's right.
And it's also very, very good for you to sign up for those apps. For I go to Mercy and I go to Penn. Penn has, both of them got my chart, but Penn a little bit different. So anything that you need is going to be in that chart. You download it, and then your appointments, it sends you reminders, so that you know what's going on with your health, because you can't depend on somebody else to take care of your health. It's your responsibility.
It's your responsibility. It's so true.
Sometimes we quit to forget, they're going to do what they're supposed to do. But sometimes they really don't.
Entirely forget.
Yes, and they're humans too. So we got to stay on it. Let me see one thing here. Okay. Since we are Africans and we eat a lot of oil food, lipids that's the cholesterol. It can be high regardless of your body size, because it's what you eat. If you're eating a lot of fatty food, it's just going to sit there. It will turn to fat. So the best type of oil or the best type of fats to eat is the one that is in liquid form, because they're not going through the process of breaking down. Like butter, when you're eating butter, eat it sparingly. Don't let you know how we can do it, man. Got bread and tea. Oh, we not slap it on our bread. We not slap it on it. We so small than the butter, and then we're eating it. So it's gonna take a long time for it to break down. Once it breaks down, it's going to like it's usually sits on the walls of the blood vessel, and it gets stuck there.
Jesus.
Yeah, it gets stuck there. Yeah, so we gotta be careful with the I know we like to eat a lot of palm oil. Palm oil has high concentration of fats. Yes. So when cooking the topogi, if you are choosing between palm oil, and coconut oil is better.
It's better.
Man, do I see, man?
Yeah. Even though it stinks
I know for petrol greens, cassava leaf them.
yeah, coconut oil is better than palm oil when you're choosing, which one is healthier. One last thing, for those who are diabetic, or those who they tell you are pre-diabetic, whenever you go to the hospital and they tell you have diabetes, especially those who got family back home, most of the time when people go there, they get there and say you diabetic, you get sugar sickness, but they're not telling them the test that they did to arrive at that decision. So I always tell them, what test did they do? What a number? So it's a hemoglobin A1C. It checks your blood sugar over a period of 2 to 3 months. And if that number, let's say every month, is over 200, 150, 175, 500, they can add all those numbers together and find the average. So the number that you will get will be your A1C, and they want that number to be under 5.5, I think. So if it's over there, let's say 5.6, 5.7, then when it gets closer to the 5.5, then you're pre-diabetic. When it gets over, then you are diabetic. And then depending on how high that number is, if it's under 6, usually they will start with oral anti-diabetics. They will give it to you so it can bring your blood sugar down. If it's too high, if it's 6, definitely you're gonna have to start on insulin. Yeah, you have to take the insulin.
I'm about to say, if it's under 5, it won't give you anything too. When it's trying to 6, they give you metformin. After, if it's like 7 or 8, then they'll try to give you insulin. When you be admitted to the hospital, they will never give you metformin. They'll always give you insulin.
Yeah.
They won't give you no metformin. When you go home, they'll determine whether you get insulin or whether you can go back to the metformin. If you pre-diabetic, it's like 5.3 or 5.4. They'll determine whether you got to change your diet to keep it in that median, or if you got to do other things to so it won't spike or go up.
Yeah, that is true.
Jesus.
Yeah, so when we go, we check those numbers. When the doctor tells you pre-diabetic, diabetic, whatever terminology they use, just make sure that that's the test that they are doing to tell you what type of diabetes you have, so you can know what to take. And then now they got different types of medications that they giving now, and most of them are effective. They got those pens, they got different type of needles, because when you're taking insulin couple times a day, it's halfway to be compliant. And if you are not compliant with diabetes, your blood sugar will just be all over the place.
Jesus.
So you gotta be compliant, and sometimes you gotta take your blood sugar 4 times a day if you're really brittle diabetic.
You take it before you eat, after you eat.
Yeah, so it's we out of time. So does anybody have any questions, additions, subtraction?
Yeah. I have a question. And first of all, thank you for the knowledge and your explanation. Well, in the area of the blood, talk about when you are caught, the manner in which
We
they
have one mic so the phone we can hear
Okay.
questions. Just for the audience.
Okay.
only.
And my question is, if you are caught, like something caught your finger or what have you, the time it takes for the blood to stop, does it have any problem with taking aspirin?
No, go ahead.
No, he said let you answer. No, he said go ahead.
No, aspirin is not technically a antiplatelet.
Okay.
Yeah, it doesn't. That's not how it works. They call it I think anti-aggregation. It prevents the blood from like gathering together, but not necessarily clotting.
Okay.
So you think that if you're taking aspirin, that's what will make your blood to not for your clotting time to be longer.
No, my concern is that if the doctor tells you go take aspirin 81 milligram, which is the baby aspirin, it helps you with your blood not to clot. So in your explanation, you talk about when you are caught, the period it takes for the blood to stop. It is my concern.
What is the aspirin that is
the
causing
aspirin
it?
that is causing it, or
Not if you usually when they're giving you aspirin 81, they advise you to take it. It's not necessarily if you have a clotting issue, that's not going to be the drug of choice. It will not be aspirin. They give you aspirin to prevent strokes. People used to take aspirin for a fever and stuff, but they use it still for that, but not really. They're giving it to you so your blood can be the right flow so that it doesn't get thick.
okay.
But aspirin will not, 81 aspirin will not cause your blood to be thin. Even when you go to the hospital and they're suspecting a stroke, like the type of stroke that you don't bleed in, they will give you aspirin. Sometimes they will give you 324 aspirin times 3. Just so if there's anything going on, there's any clotting going on, it will take care of it until they give you the actual clotting medicines then. But aspirin 81, it doesn't do that.
Okay.
Yeah.
Thank you.
Yeah, this is a pro campaign, you know, but-
Oh no, that was good. It's okay.
You ain't got no input?
Huh?
You got
Oh,
no
no, she asked
You answered the question?
yeah.
Alright. Anybody else? Alright.
All right. Thank you for your input. Thank you for listening. Maybe next time we can start because these discussions are good. It's good when we do it. We have more time, then we can really dive in.
Yes.
Yeah. But
We got another hour in here too, so.
Yeah.
Was it- Oh, I'm sorry. Was it a
No,
Bible verse to the Was it a Bible verse to the to the
no, I started with Psalms 103, 2 and 3 about healing.
103.
Mhm.
Okay.
Yeah.
Yeah, so for her, the Sunday school, she do the medical side of the teaching. Just so you know, Sister Pearl.
Okay.
Yeah. She come with medical teaching and then to go on city, come with regular teaching.
Okay.
So the alternate Sunday schools.
Okay.
Yeah, that's how we do it. Alright.
Now who got me?
Yeah,
That you?
yeah, I can.
Thank you all for watching. God bless you. Just so you that on your way, we'll see you when you get here.